Good afternoon, everyone, and or good morning, depending on where you are, part of the world. Wishing you all well. My name is Ezra Zuckerman-Sivan. I am MIT Sloan's Associate Dean for Teaching and Learning, and it is a great pleasure to welcome you to this, the fourth in our Ideas Made to Matter series. In this series, we've invited MIT Sloan faculty members to come together to share some of their latest, greatest research and insights together with you, the greater MIT Sloan community this summer. So far, we've explored diversity, equity, and inclusion with Professor Ray Reagans. We've discussed the challenges that coronavirus and beyond are posing for ethical business decisions with Roberto Rigobon. And we've discussed Aaron Kelly's forthcoming book on overload and what we can do about it and how the coronavirus relates to that. Today, it is my great pleasure and privilege to welcome you all to a talk by a conversation with Professor Tavneet Suri. Tavneet Suri is the Louis E. Seeley Professor of Applied Economics. She's been a faculty member at MIT Sloan since 2006, after she received her PhD in economics from Yale. Tavneet is one of the world's leading experts on the role of technology and entrepreneurship in economic development in general, in particular in sub-Saharan Africa. Tavneet is the editor-in-chief of Vox Dev, and I'll put a plug in there. Check out www.voxdev.org. I think I'll check that out, make sure that's right. Is just an incredible online source for the most rigorous research and how it relates to improving our world. Tavneet is also the scientific director for Africa for the Abdul Latif Jamil Poverty Action Lab, that is JPAL. She's the co-chair of the Agricultural Technology Adoption Initiative at JPAL. She's the chair of the Digital Identification and Finance Initiative at JPAL Africa. And, I'm not done yet, a faculty research fellow at the National Bureau of Economic Research. I also want to emphasize something that I've gotten to know Tavneet, I think, well over my 5 years that I just completed as Sloan's deputy dean. And what I can say with some authority, I think, is that Tavneet is one of the most important faculty leaders at MIT, not just MIT Sloan. Tavneet is known for the clarity of her moral vision, as well as her hard-nosed, pragmatic leadership. And I want to, in particular, note her leadership on a really important committee, perhaps the most important service that any faculty member could have done in the past year, and the ad hoc committee, a faculty committee on guidelines for outside engagements. Today, we're here to talk about research, Tavneet's in particular, fresh research. She's here to share insights she has gained through her ongoing research on implementing universal basic income in Kenya. And so, Tavneet, I'm gonna invite you to show your video and unmute yourself and share some research. You'll be talking for about 20 minutes or so. And then I'm going to have the great pleasure of being able to engage with you a little bit, and want to welcome everyone to ask questions using the Q&A function. And I'll do my best to read your questions and to redirect them to Tavneet. And I'm really looking forward to the conversation that we're going to have. So Tavneet, welcome.
Great, thanks Ezra, and thanks for that overly kind introduction, including committee introductions, Ezra. I didn't know when I didn't realize we included those in our resumes. So welcome everyone. It's really nice to be here this afternoon, and thanks for joining us on this Ideas Made to Matter summer series. And I'm excited to be a part of it. I know you've heard from some really amazing Sloan colleagues of mine, and I'm excited you got to listen to them. I'll try and keep up the bar. So as Ezra said, today I'm going to talk mostly about some work we've been doing on universal basic income. For those who don't know what a UBI is, let me give you a sense of what it is. You know, a lot of the world, especially right now, has been talking about what the role of social protection is in an economy. What is the role of the government in social protection, in providing some form of resilience or insurance to people, especially during bad times. The idea of a universal basic income is to give everybody, hence the word universal, a basic income. And a basic means cover very basic necessities for people. And you know, this is raised in many ways. In Europe, it's a social protection measure. In the US, until COVID hit, it was mostly a worry about sort of automation and the loss of jobs. And so it's talked a lot about in the tech sector. As COVID has hit, of course, this is now taken on a discussion more broadly in the US. So as Ezra mentioned, I mostly work on sub-Saharan Africa. And so I'll talk about what we're doing there and the reason we've been thinking about a UBI there. But that's the idea, is we've been trying to study kind of this notion of having a UBI and what the impacts could be. So let me describe what we've done, and I'll give you a flavor of results. These are really hot off the presses, so I'm not even going to use slides. I'm just going to talk. And we literally have data coming in right now as of 2 weeks ago. So these are truly hot off the press results. So we have been studying, or we have set up a randomized controlled trial. Think of this as a clinical trial, or similar to how we do clinical trials, like the clinical trials for vaccines for COVID happening in the US. So we set up a randomized controlled trial around universal basic income in Kenya. It started about over 2 years ago. We raised a bunch of money to provide people a UBI. In total, we're working in about 300 villages. We're working in the 2 poorest counties, or 2 of the poorest few counties in the country. And the notion of giving people UBI in this context is sort of, the idea is to get people out of poverty. If you think of, you know, people being in poverty traps or being stuck in poverty, we're hoping the UBI can help kick them out of us. Okay, and I'll talk about this as we go. But we wanted to test it. The reason to set up a study is, you can imagine there's both good sides and bad sides of the UBI. Many have been talked about at length in the US as well as more broadly. The pluses are, it could raise your incomes, it could allow you to invest in things you don't invest in, and I'll talk a bit about those when I share our results as well. And there are downsides. You could imagine that I give everybody a UBI and they stop working. That's a common one you hear in the US, is that, you know, giving people a basic income of some sort is going to make them put no effort in finding a job and not work. The other downside is they could spend it on food, and food prices would go up, and then you don't actually gain as much as you think you're gaining. Others might be, you know, there's more crime because people realize there's a bunch of money around. You could imagine a few of those other constraints. You know, in a developing country context, the other one we think a lot about is elite capture. You might think that the powerful people in the village just come around and extract chunks of it from you. Okay, and so it doesn't actually do what it's supposed to do. So over the last few years, we set up this huge randomized controlled trial in 300 villages in Kenya to study a UBI. A bunch of villages, about 80 of them, are getting what we call a short-term UBI. I'll describe the exact amount of the UBI, but they're getting a UBI for 2 years, and they get a payment every 2 weeks. And the payments all go out over mobile money. Kenya has a very well-developed mobile money system. A second group is getting a lump sum UBI. We give them the equivalent of the 2-year UBI, but in 2 payments up front, 2 weeks apart. So they don't have to worry about it kind of coming in a regular interval. It all comes up front. And then the third group is getting a 12-year UBI. So they're going to get a regular payment every 2 weeks for a total of 12 years. We're 2 years into the UBI right now, pretty much as of July. And so people have had 2 years of this UBI. Of course, the lump sum group got all of it up front. What is the UBI? We're giving them about 75 cents per person per day. And so if you think of poverty rates, we usually use, you know, are you living under $1 a day? We're giving them 75 cents of that per person per day. And that's going, like I said, for some people for 2 years and for some 12. And then the other piece is, just to give you a sense of magnitude, it's universal in each of these villages. So we're not targeting at all. We're not saying rich people don't get it. It goes to every single person in the village if the village is in the treatment group or in the trial in the treatment group. In total, we have something like 30,000 people in the study, of which about 22,000 are getting a basic income of some sort. This is about $25 million of transfers over the next several years. So it's quite a hefty chunk of money being dispersed in this UBI. So as I said, we've been planning this for a while. So our first set of data we collected post the UBI was in the late fall of last year. And the data collection effort has also been rather crazy. So we have collected a ton of survey data in all these communities, and we're trying to measure a whole bunch of outcomes around, expenditures, incomes, wealth, assets. We're trying to collect a bunch of outcomes on health, on attitudes towards women, on domestic violence. We're trying to get a better sense of social integration. So all those things at the household level or at the individual level. We're also collecting a bunch of stuff on prices out of all the markets in the areas. And then we also did a huge effort at recording and documenting every single business that existed in these communities, and then collecting data on their profits and incomes and how the businesses are doing. So it's been quite a big exercise in data collection. And then, we were collecting these through the fall and early spring. We also kind of tracked all the people that migrated out of these communities to follow them to see how their lives were changing. And then, of course, come March, COVID hits. So in May and June, we followed up with our surveyed sample to try to understand how they were being affected by COVID and whether the UBI was kind of helping them deal with COVID, given the restrictions that the country had imposed around travel and trade and transport and markets and public gatherings. So let me give you a brief kind of view of those results. So I'm going to tell you kind of what we found both in the late fall and spring before COVID, and then how that's affected post-COVID. I should say, just to give some context on COVID in Kenya, it has resulted in a bunch of kind of restrictions on public gatherings, some lockdowns to start with, some restricted use of public transport. Some of those got lifted more recently, but meanwhile, cases have grown quite a lot in the last few weeks. So in all likelihood, some of these restrictions will come back on. Okay, so let me give you a sense of what we're finding out of this randomized controlled trial on UBI. The first piece is that we're finding big improvements in health in the end line, really significant improvements on mental health as well as physical health, not just physical. These are kind of 10 to 20% improvements in health status for people. We collected a sort of a specific depression module. This is a 15% improvement in a depression index. And then if I kind of look at COVID times, we find that these improvements kind of persist. They don't get eaten away by the COVID restrictions. So you see the similar kind of differences between those who got the UBI and those who didn't get the UBI in June as we did in the fall. Okay, and so that's good in some sense that at least the gains that we're getting out of the UBI aren't being sort of blown away by what's happening, at least not yet. So that's the health piece. Let me talk about the food security piece. So we kind of measure how hungry families are and whether they feel food secure. So we measure kind of, how many days did people in your house not have any meals in the last month? How many days did people in your house not have more than one meal or had only one meal? So things like that. And so here we see, again, big improvements both in the fall from the UBI, 20 to 30% improvements in food security. That means you're far less likely to have people eating 0 meals in your house. You're far less likely to actually have people eating 1 meal. You're more likely to have people eating 2 or 3 meals, okay? So we see these big improvements in food security. And again, these persist through May and June. in May and June, we find similar big differences between those who got a UBI and those who didn't in June during COVID. So people are both sort of households who got a UBI are both healthier and better fed, and both of those effects are persisting through what's been happening the last couple months. Okay, let me talk a bit about incomes because those are kind of interesting. So one of the biggest findings in the fall and the spring that we saw in our data was there's a big increase, a 20% increase in people having a business of any sort. Okay, and that's pretty striking and large, especially for poorer communities. And this probability of having a business persists. Again, we still see those businesses and they're still there in June of this year. So that's a kind of big piece of what we're finding. I just want to talk about this piece a little more. You know, there's certainly a lot of work in economics now showing that poor people often do low risk, low return things. And the reason is if I'm really worried about feeding my family tomorrow, I don't really want to do a high risk thing because it might wipe me out completely and then I can't feed my kids. So this notion that, you know, I really have to worry about being able to feed my family leads people to do low risk, low return things because they can't absorb the risk. There's no insurance markets. Usually when we think of risky things here, we feel like, oh, either I can buy insurance, I can buy flood insurance, I can buy this insurance, I can buy health insurance, or there's sort of social protection from the government that provides that insurance, right? And so in Europe, you think, oh, I'll get, you know, unemployment insurance from the government if I lose my job. In developing countries, both those pieces are largely missing for the poor. They can't afford private insurance markets at all, and the governments don't really provide much social insurance. And so what are they left with? They just have to deal with risk. And the reality is they live in just riskier environments, right? The weather risk is high, and that's where a lot of their income comes from because they might be in agriculture. There's a high disease risk, you know, and now higher, but even aside from COVID, a high disease risk environment. So they live in environments that just have a lot of risk, and yet they don't have the toolkit to deal with that risk. And so we've realized that being able to provide people toolkits to deal with risk is really important in these economies. It might be even more important than giving them loans or anything else, right? This notion that they can't insure away the bad sides of their lives is really salient. So in this piece, you know, in the UBI piece, we think of the UBI as providing a bit of that. So I was going to do low risk, low return things because I'm really worried that I need to feed my family. I get a UBI. I know that food and health are taken care of out of the UBI. So now I can go do risky things. Now I can say, okay, let me go do this risky thing because I know that the UBI is going to provide for me if that goes badly. And so I think we see this. We see this kind of big increase in people starting enterprises and starting firms. And you know, these are small firms. These are mostly 1-2 person firms. Don't think, you know, starting Apple or something like that. So, you know, that kind of fits this notion that the basic protection can sometimes let people kind of go do what they wanted to do and go try something that they've always wanted to try and just couldn't because the risk was high. Okay, so that's the enterprise piece, which I find exciting and fascinating, and hopefully we'll be able to track over time as well. We do see enterprise profits go up in the fall when we collected data for the fall and the spring. We see a big increase in enterprise profits. We see a big increase in wage income as well in these households. In June, we actually see those two get largely wiped out, mostly, especially enterprise income. So the UBI households started new firms. These firms were doing really well, making lots of profit. A lot of that profit gets wiped out. Let me be very clear about one thing. We have one big caveat to all of this, which is COVID hit during the hunger season in this part of the world. So it's commingled with this huge seasonal cycle that all agricultural economies or poor rural economies face. there's a huge seasonality in the availability of food because I harvest after the rains. I kind of store some food and I eat it as I go through. And then when I run out just before the rains or just before the harvests happen again. So COVID actually is hitting at least Kenya at the same time as a hungry season. So we can't tell if this wiping out of profits is just because, you know, it's hungry season and people aren't buying whatever you're selling, or if it's because I'm a trader and the trade restrictions around COVID stop me. So to try and tell apart those two, we just literally have data being collected now around the markets and the lockdowns. And I'll talk a bit about that at the end. But we're trying to understand which markets got shut down and where, which kind of trade routes were closed, and what did that prevent from happening. So that's the income side of what UBI is doing in these communities. Let me talk about one last piece, and then I will run out of time. In the June survey, we actually tried to ask about social distancing as well, to see if there was any effects of the UBI on social distancing. Was it helping you social distance yourself? Was it helping you kind of deal with what was happening around you and sort of, you know, figure out how to deal with COVID a little? So we do see two things. One is that there is a reduction in the treatment groups, the people who got UBI versus those who didn't, in seeing your friends both in the same village and in other villages. So they do reduce some of their socializing behavior a little. And then as I said, we've just been tracking markets. So this is especially hot off the presses result, as in last day. We kind of track markets. And remember, as I said, it's hungry season. So in hungry season, these poor people are generally trying to buy food because they've run out of food, right? And so we kind of documented in these communities which markets actually shut down because of the COVID restrictions and which ones didn't. Because some communities, actually almost 3/4 of our communities had markets open. Even though the restrictions were imposed, they were just sort of still keeping markets open. So we see that in places where the markets were open, the households that got a UBI versus those that didn't were actually going to markets far more often to buy food. So we asked them, did you go to a market to buy food, and how often? And we see a huge increase in the UBI households in the areas where markets were open for them to go buy food. And so again, this kind of matches back nicely to our food security results, right? We said they were less hungry. It's because they were able to go to markets and buy food because they were getting a UBI through the down season, through the hungry season. And so we see that, but in areas where the markets were closed, the UBI did not help them because the markets were closed. There was nowhere to go buy food. And so they actually didn't see increases in going to markets. Okay, so those are kind of the top line results of what we're finding on the UBI and on the social distancing and COVID side. I think we still have tons of data more to look at and tons to sort of collect as well. We're going to try and monitor what's happening over the next couple months as COVID potentially gets worse in Kenya. So we're hoping to be back out. We're also hoping to kind of survey when harvests are done for this year, so we can see whether people are unable to sell their crops because there's now more restrictions because of COVID. So those are things we're hoping that we'll be able to document. Let me just quickly wrap up and then hand back to Ezra, because I think I'm going to be out of time in a second. I think the one thing we're learning from this big randomized control trial on UBI and the interaction with kind of COVID and seasonality and these big events, whether it's seasonality or COVID, there's persistent effects of the UBI through these times on health, on entrepreneurship, and on food security. And they're reasonably large and sizable. We also do see that, you know, this ability to take on risk seems to be one core piece of this. You know, if I can provide you basic protection, it seems people are willing to take on more risk and try things that they've wanted to do. And so that, that's a kind of nice piece of the UBI that we often talk about but didn't have evidence for, which is, can you actually go do what you want to do because you don't have to worry about trying to figure out how to pay for basics tomorrow. And when I take that out of your decision, out of your worry set, does it allow you to do all these other things? And I think we're starting to find yes. One caveat I will say is we still have lots of data to look at, including price data and crime data and all these things. So I'm hoping that over the next few months, we'll have an update that will give you the full set of outcomes and data and findings. And I'll stop there. Thank you for being with us this afternoon. I'll hand back to Ezra.
Well, you can hand it back to me, but I'm going to hand it back to you in a second too. So let me just say that was, so words that come to mind are not just important. This research is certainly very important and inspiring. Just putting aside the fact that you're actually studying, how the world works, you're actually, it seems like you're improving the lives of the people that you're studying already, which is just a source of great pride. So it's great to be here to talk to you about it. So I got a whole bunch of questions, and there's a couple on the Q&A that I want to bring in as soon as I can. One question I want to ask, so there's a bunch of things about context that I think will be interesting to people. One is about your intellectual, maybe even personal biography and how it fits in here. And there's two questions that come to mind. One is, so I think people in the MIT Sloan community are familiar with, I'd say, the policy orientation of our faculty, the ideas made to matter, right? But especially with, there is a myth out there about what it is that business school faculty study, and it might involve more, some image of CEOs and their war stories or something like that. And this is quite different from that. And so I'm curious, and then the other part of it is, you didn't mention that you're Kenyan, right? And this is a part of the world that you know and care about deeply. And so I'm curious how those two things, how you think about those two things, about being a business school faculty member, being a Kenyan, and how that relates to the research.
Ezra goes all the way in. Thanks, Ezra. I'm happy to talk about both those pieces. Let me reverse the order. As Ezra mentioned, I am Kenyan, born and raised, and still the only passport I own, which is not so great, because it means I can't go anywhere right now. So, Ezra, I'm completely motivated by questions in that part of the world because that's where I'm from, and I care about that part of the world tremendously. Shockingly, as that might be, Ezra. I've worked on Kenya for a very long time, and other bits of Africa too. I've worked in Rwanda and Uganda and Tanzania and Sierra Leone. But I think Kenya will hold a special place because it's where I'm from. I think the other piece that is kind of interesting, especially right now, is I think it's somewhat easier also being Kenyan to navigate both doing research, being on the ground, doing field work, building up partnerships, trying to speak with policymakers to sort of, get results of things you work on out there. So I think that whole piece has also been a lot easier actually than it is for others. And so, I also see it as like, pure economist comparative advantage. It's easier for me to work in Kenya. I know my way around. I know languages. I know people. I have networks and contacts and things like that. As you know, but as the people on Zoom might not, I've spent a chunk of time working on mobile money as well in Kenya and its impacts on poverty, where we're finding mobile money provides resilience in a similar way that I've been talking about with UBI. So in an intellectual heritage sense, I think the UBI project fits nicely with my agenda, which is about both providing resilience and then seeing how this affects communities and communities economically. In the mobile money piece, we found in the first few years it provides resilience, and then we see women actually start businesses as a consequence. They kind of changed occupations because they felt safer. They felt like they had a safety net through mobile money. And so I think intellectually this piece kind of fits nicely. When we first saw the resilience effects, my collaborators were all like, oh, Tavneet's going to be happy because it's just an intellectual heritage of what I've worked on for a very long time in this part of the world. And so, you know, I think there's two pieces of the Kenya piece. Both I care about it, Ezra, but it's also just easier to navigate and function, and it's easier to take results. You know, with the mobile money piece, I worked largely on surveys and then a collaboration with the private sector, with the telco. And there, you know, I got invited to Vodafone held a meeting for all their heads of mobile money across all their markets. And they basically invited me to present there, right? So you kind of build these relationships, which are just easier if you're from there. There's something in common, and it's easier to communicate and connect and do all these things. And then, you know, hopefully you can present results that have some impact somewhere in a policy or a private sector space. The other piece, Ezra, on a business school, I think, you know, I don't have a great answer for you other than, you know, we care about the world, and we care about having an impact on the world. And whether that's in this part of the world here in the US or in CEOs, or whether it's about, you know, poor people starting businesses and taking on risks and understanding properties of the financial world for the first time, I don't know that we should care too much other than, is it important questions in the world, and is it possible to sort of add evidence in a space where there is none? And in that sense, you know, there's so little evidence in the parts of the world I work on, and so few people working on it, that, you know, maybe it's okay that some of us do that, even at Sloan.
I think it's more than okay. Like I said, I think it's a source of great pride. It certainly fits in with, I think.
Yeah, Ezra, I joke on UBI, the only downside is, like, you know, people all think we write bequests for our wealth. This is a 12-year project, and then people will want to do long-term effects of a 12-year project. And I was like, well, in 20 years, I'm going to be writing a bequest for my research. So,
so okay, that actually relates to a couple of questions I wanted to ask. I'm going to build towards some of the questions in the Q&A.
Sure.
And they relate to, I mean, probably it's impossible to overemphasize how unusual, how large, how complex, how risky this research project is, right? This is not a, you know, and I've done such projects, you know, I get an idea and then I run some online experiments on Amazon Mechanical Turk, and then I slap it up and maybe I've got a paper within a year or something like that, right?
No,
so
it's not curious, that.
No. So I'm curious about a couple of things related to that. One is, so you said it's 25 million bucks. Was I remembering that right?
So it's $25 million of transfers. The UBI is worth 25 million.
Just right.
Just
right.
The UBI. And then the
so
study.
I'm imagining. Okay, so finish the description of the
this round of the study, just this round, this fall through till June, I think we spent about $1.5 million on just that.
Just this round. Yep.
Just the data collection and just the study. I had a team of 300 odd people working for me in the fall through the spring.
On the ground.
On the ground.
And
yes.
I assume collaborators, students, and others here.
And actual staff.
All around the world.
Hired
staff. Yeah.
300 people to collect data. We do surveys face-to-face because there's no online, there's no phone. There's phones, but phones are not great. We will do phone surveys now through COVID because we can't do face-to-face, but we do all of our stuff face-to-face, fieldwork, right? So yeah, the team was about 300 people. So it's it costs money to run an operation like that.
Yeah. So I was going to ask a couple of quick questions related to all this. So one has to do with just, yes, you give a sense of the complexity of it, but also, like, you know, if there's a major challenge out there that you faced and you somehow overcome in getting this done, and just to give us a taste of what one of those challenges might have been. I'm sure there are many that will give us a sense of the nature of the undertaking, besides just the amount. Yeah. A second question I guess I had was about, you sort of alluded to this just a moment ago, was the time frame. So I'm thinking about, how do you make a decision about when to cut the project to produce a report or a paper, and then will there be a book at the end? You know, how do you think about that? And the third question I guess I have is about audience, right? So if there's a $25 million transfer, the heart of this, so presumably either a government or maybe a major foundation might be in the position of allocating $25 million or more down the road. And presumably then you're comparing the kind of results you were describing versus maybe they can get the same results or different ones from some other investment. So how do you think about it? Like, if you were pitching this relative to the funders, what they might otherwise be using their funds for, how do you think about that? So there's too many questions in there, but they kind of all.
There's a lot of questions in there. So let me try and do lots of them. So, I mean, as a huge undertaking, we had to raise the money for this first, and that took a lot of time. The money for the transfers comes from about 20 to 30 different donors. This is a piecemeal collecting. Think of it as a pot, and everybody has a hand in the pot, right? So it's a bunch of big foundations and donors and all sorts of bits and pieces in there. So the fundraising is hard and stressful and intense. And then, the fieldwork piece has been huge, bigger than anything we've done or I've done personally, and also very spread out. So, I have colleagues who work in India, and we always joke about this, like village sizes are 10 times in India what they are in Kenya. So to get the same sample size, I have to go through not just 10 times the number of villages, they're also more spread out because population density is way lower. And so you just kind of have to scale geographically, which means actually costs scale with geography quite a lot. So every observation in India costs an order of magnitude less than an observation for us, right? Because it's just so spread out. So I think one of the challenges for us was we were in two very different parts of the country, running running 4 different teams. We had teams doing a household piece and an enterprise piece. I don't think I've done anything quite that complicated ever. Usually it's one team. It might be a big team of 50 or 60. We've never run 4 different teams in 2 different places. Think of it as running in 2 different parts of the country. I think the key to success there was I have such an amazing, amazing managing team, right? I'm not on the ground. And in fact, I was supposed to be on the ground in February and COVID starts to hit and I was like, I don't think I'm going anywhere, right? So I'm not on the ground all the time. I'm on the ground a lot, but not in a persistent way. So I think having a really great kind of layered management team that is both good and effective and understands sort of, how important it is to sort of communicate and do this across continents is really important. So I think that was key. I am so grateful for my research managers. They were awesome. And I think their passion and commitment was equally important. Like it's something they really cared about. And so, the complexity has been an order of magnitude more than anything I've ever done before. I will say,
given that, how gratifying it must be to get those first slew of results that were so encouraging.
Yeah, I know. It was it's kind of exciting. There'll be more. There's lots of number crunching going on even right now, I'm sure, Ezra.
So by the way, on the question I asked about, sort of the policymaker, there's a couple, I just want to mention there are a couple of questions in the Q&A that relate to that.
Okay, good. So let me talk a piece about that.
Okay.
So most of this was funded by a bunch of donors. I think the aim was to understand whether this really gets you out of poverty in a very systematic, long-term way, right? And so they're interested in that piece of it. I think on the policy side, we are also talking a lot with governments to talk about what their social protection schemes are and how. And so I'm hoping that once we have findings, there's a piece in there where there's some governments that are going to do this. I mean, India's been talking about it. They talked about it in their last election that they were going to do a UBI, right? So there are some policymakers that are at least open to thinking about spending some part of their resources on this. One thing to note, I did say this, is, our UBI, as much as it's a big pot of money, it's a small amount of money per person because these are really poor countries, right? It's not that much money. It's not a UBI in the US, which would be a lot more money, right, per person. This is a small chunk of money per person. And so it's a very different budget equation in that sense than any developed country. And that's what's striking when you start to put this together. You go, hang on, I just gave 25,000 people a UBI for $25 million for 10 years, some of them. Like, it's not crazy, right, in a budgetary sense. So
to that point, there's a question that maybe relates to this, which is, you know, why 75 cents?
Yeah.
So
we kind of,
number?
Yeah, we kind of tried to figure out what basically food and a bit of health and a tiny bit of education would be, right? What's the minimum you would need per person, per adult for that? It's per adult because it's all going on mobile money. I should have been clear. So we kind of try to figure that out and then get a round-ish number that works. And then, you know, we often use extreme poverty cutoffs at $1 a day-ish from the World Bank. And so 75 cents felt like, okay, I'm getting you a chunk of that, right? Not all of it, because you are making about $1 a day. This is going to get you a chunk more. So for some people who are who are poorer in those communities, this will be a huge chunk more than what they had before.
Got it. What about the question about like how you decide to cut up the research and report on it?
So this has been funny because I think I'm also the youngest collaborator on the PI list, on the list of, I think that's right. So because one arm has 2 years and one arm has 12, we wanted to capture the 2-year effects. Because think of the 2-year and the 12, they're getting the same stream of payments as every 2 weeks, they get the same amount. Except the guys for 12 know they're getting it for 12, and the guys for 2 know they're getting it for 2. And so you can see whether knowing you're going to get it for longer actually changes what you do. And that we have to measure now. We can't measure later, right? So that piece we measured this year. And that's one of the focuses here, which will come soon, is kind of, are these different by the long-term and the short-term arm? Because you know that I have certainty for 12 years, not just for 2 years, right? There might be a difference. So we're going to do 2 years. And then I think the aim is to survey every 2 years through the 12, which again means fundraising a couple $1 million every 2 years for the next next 10 years. And then my guess is we will stop doing such regular things and then try and go back maybe every 5 years. At that point, I really need to hand it off to someone else because this will be the longest research project. You know, we've talked a little, I don't think we'll do a book, Ezra, but my guess is every 2 years there'll be a paper with the data collection just to say, did the effects stay? Did they wipe out? You know, kind of what happened. Sure. The other piece we've talked about is try to get a documentary filmmaker in to do some film around it. We're careful with the press. We've been because of, you know, kind of confidentiality reasons.
So by the way, there's a question from Michael Lipton, which is, what ammunition can you provide to help us justify to potential donors the value of the UBI approach? My guess is the best answer is this research, and though that does relate to the question of how you're going to publicize it and when it will become more, you know.
Yeah, it's not very public, by the way, guys. You're literally hearing hot off the presses results. So I think we'll have a piece out in a couple weeks on the COVID side, just because we want that to get into policymakers' hands immediately. So that piece we will have out, I'm hoping, in a couple of weeks.
In what form and in where would it be distributed?
So the first place usually is we'll post papers on our websites, and then we have a partner. So JPAL will probably do something, the Poverty Action Lab, that's a little less academic and a bit more easy to consume. One of the donors on the COVID piece, the COVID surveys were funded by a particular donor, and they're already like in the send us the results. We need to start doing some like non-technical communications write-ups. So there'll be a bunch of those coming out of JPAL and then the technical ones on our websites. Gotcha.
Great.
And then I'm hoping by the fall, the full end line results, which are the prices and all those outcomes, the 50 or whatever of them, that will be out in the fall.
Yep. Great. So a few questions now, getting a little bit into some of the specifics. Sure. There's a question. So I myself am interested in the 3 different arms of the study, and I guess there's a question of sort of what were you trying to test with those 3 different arms. And then there's a question, at least one, about at the results. So Jerry Lutz asked, was there a difference in entrepreneurship between the lump sum group and the biweekly payment group? Let me add into one other question here, which I think is very interesting, from Linton Brent Manson, which is, of the 20% increase of having persons have a business, what percent is it for women? So like the gender angle, which is a separate question, but it sort of relates to the results.
Good, okay, awesome. So the reason to have the 3 different ones was, first, how long should we commit to a UBI for? Is it a really long time or a short time? And does a short time give you enough of that push out of poverty that you're okay, right? If you think really people are not doing high risk, high return things, and then they go do this, they make a ton of money one of those years because the business went well and they're out of poverty and then we're done, then we don't maybe need it forever. So the kind of short term, long term was that. I will say 12 years was just chosen by how much money we raised. We just went short term and then as much as we can do. So, and calling it a day at some point and stop fundraising at some point.
Said you were pragmatic, Tavneet. There you go.
Exactly. At some point you have to say, okay, I think we need to stop. And then the lump sum arm is just, you know, there is a literature in economics around people not being able to save very well and being savings constrained in different ways and for different reasons. I can't really save because I have so many calls on my money. It's really hard to kind of commit to putting money aside when needs seem so salient, right? Or I have such an extended family that if I save, I know they're going to come and ask for a loan because they need it and I won't be able to say no. And so I may as well spend it, kind of thing. So there's many reasons. That's not the only set of reasons. But if you're really savings constrained, then the regular payments, if you can't actually save them, you might not be able to make a big investment. If I want to start a business, maybe I can't make the big investment because I would need to save for 6 months and I can't really do that. So the lump sum idea is maybe you just need a stack all at once so that you can go do something. Technically, the UBI is a stream of income, right? Universal basic income, it's supposed to mimic a stream of income. So it is a stream, but we wanted to know how different is it from just giving you the lump sum. On the effects on entrepreneurship, they're actually the same across all 3 groups, which was contrary to any of my expectations or hypotheses. I would have thought the short term would be less likely than the others to start a business because they would think this is only 2 years. I need to do something with it for 2 years because it's really short term. I thought the lump sum could start a business because they had capital. And the long term, I was kind of like, I don't know if they will or they won't because they might need to save, right? So at the moment, actually no big differences in the probability of starting a business.
Does that imply that the key, you know, there's just getting any amount of cushion is really the key thing, and then the specificity of the nature of that cushion just doesn't matter as much?
Yeah, I think that's right. I think that's sort of how I would interpret those. There might be other models of the world, but I think it's much more this resilience piece, right? I always wanted to start a business. It's not everybody starts a business, right? There's only a 20% increase, not a 100% increase, right? So there's some people who are going to start a business if they could. And if you really just care about downside risk and I've provided you enough protection from downside risk, then you go do it. Now, if that's really true, the lump sum guys might have spent more on the business than the others, which means they might run out because they don't get the cushion forever, right? So depending on how they use that lump sum, they might, that effect might decline over time for them, right? Because they don't have the cushion to keep coming. And then the 2 year, yeah, they have the cushion for 2 years, but then let's see what happens after that when the cushion disappears.
Yep.
Right.
Do you want to, so there's, I'm
on the time. Gender, it's on our to-do list, haven't done it yet.
Got it, fair enough. So we'll get to learn about that from subsequent reports.
Yes.
So I want to classify, there's 2 sets of questions here, some that are about Africa and some of them about the West. And so let's take the Africa questions first, and they're a little more specific. So let me just read them all, and then you take them as you see fit. How about that?
Okay.
So there's a question from Michael Lipton, which is about were there any special tracking and findings for HIV positive people? Nothing about that. Okay. Another question is I guess this is more general, but maybe about your project, any impact of UBI in grassroots community development organizations, such as schools, children's homes. Yeah, go ahead.
Good, so that one.
I'll keep going if you want.
Yeah, keep going,
Okay.
and then I'll try and remember them.
Another question, this is from Tatevik Zorabian, and that is mentioning that Togo has handled COVID quite well, and I think they might have implemented UBI of a sort. And then can you run parallel within the African continent, how well handling of COVID and existence of UBI correlate? Not just in Kenya. Last question from Ashoka Maduri. Great talk, Tavneet, I agree. Are there subsidies or incentives from Kenyan government for starting new companies, especially in pharma drugs manufacturing? Are there any differences for native Kenyans versus international people? There's a lot there, but.
Okay, so let me try and do a bunch of those.
Oh, one last one, sorry. One last one that's important. Vernon Yorson. I've been to Kenya many times. How far away from the major cities were the communities chosen, and were the poor involved in the design of the experiment? So I threw a lot at you. Sorry about that.
Yes, you did. I'll try and get to some of them, but I want to save a few minutes for the West questions too. So I'll try and do 3 minutes and then hand back to you, Ezra. So let me do the first few. On schools and stuff, one thing we thought about was, if I give you a UBI, when the schools really suck in your community, maybe you all get together because you know everybody's getting it and you build better schools. So we're measuring a whole bunch of what we call public goods, schools, clinics, are the schools better, are the clinics better, et cetera. So we will measure those outcomes, or we have measured those outcomes, we just haven't looked at them yet. This is the other piece of this, the volume. On the Togo side, yes, absolutely. Togo, COVID might still take over because it's hard to predict, but they did do a cash transfer actually quite well. Some of us at JPAL were involved in conversations across a bunch of these countries around social protection at this time. So Togo definitely did that. Just to give you a sense, as of the 12th of June, I haven't updated this, but I will, 195 countries had added 1,000 social protection measures in response to COVID. It covers about 1.7 billion people. And most of this was cash transfers. About 1.2 billion people got a cash transfer of some sort because of COVID as of June 12th. And that might have grown since. So Togo was part of it. There's some countries that have done a lot and some countries that have done none. And so just to give you a sense of just how much there has been. So that's why we've been trying to write the COVID pieces up, just saying, you know, these seem to help people. If they were, you know, often cash transfers are one-off and they disappear. And so trying to give them persistent ones might help a little. On the Kenya pieces, we're in 2 poor counties. One of them is close to like the 3rd largest city in the country. The other one is not. They're both pretty far from Nairobi. I'm trying to think, what else did I miss, Ezra? Anything else?
I think that might have been it.
Okay, I hope so. Yeah. If I missed anything, I should also say if people want to reach out, feel free to email, and I'm happy to take questions I missed in any way. Yeah.
Thank you for being open in that way. So let's talk about the West a little bit. There's a question here from an anonymous attendee. It says, for the US/EU markets, do you see UBI as a band-aid solution? Why not require a higher minimum wage as an alternative? Another question is, what % of a nation's budget should be marked for distribution as UBI? I have a feeling that we don't yet know the answer to that second question, and that it will depend. Yeah, but
I think it'll depend on the country and where and context and all sorts of things.
Right. Yeah, but more generally, like, what's your sense about sort of maybe particularly in the West? You know, it's a live debate. It was, I think, the first time, as far as I know, in the most recent presidential, like at least in the Democratic nomination, there was Andrew Yang pushing UBI, and now obviously we've been doing it, as you said.
Just to give some broader context, which I didn't really get to, Ezra, this is probably the first big randomized control trial on UBI that's out in the world. There's a couple of other studies, but they're not different things. There is a randomized control trial running in the US. I'm on their board. And our state was thinking of doing one. So I've been in conversations with Massachusetts, who is thinking of doing one in Massachusetts and doing a randomized control trial around it. So if that happens, hopefully in some way I'll be involved, I hope. Who knows what happens now. So just to give you context, and then there are studies running in a couple of European countries, one shut down, a couple are continuing. So there are studies in other countries that will have results. I think the way to think about the West is the UBI is meant to replace existing welfare, not in addition to existing welfare, right? It's meant to be let's get rid of this huge system that we have that does all sorts of different programs. You know, even in India, people talk about this. There's, you know, over 1,000 welfare programs in India, right? And just managing and orchestrating those. And then the amounts of corruption and elite capture and all these things that happen. Not just that, if you think of a developed country context, we think of targeting. We often target to the poor, but the error rates around the targeting are really high, Ezra. So, and it assumes that poverty is just this thing that is the same every year. So if you're once poor, you'll stay poor forever, as opposed to there's people coming in and out all the time. So a UBI avoids all of those things. I don't have to figure out targeting. I don't have to worry that targeting will miss people or get too many people or all these things. So I do think in that context, it's supposed to replace a whole bunch of welfare, a whole bunch of regulation, a whole bunch of other things, right? On the minimum wage, let me just say the minimum wage is, in my books, appallingly low. There's a really great set of resources at MIT. Amy Glasmeyer.
Right now.
Sorry?
You're talking about the US right now.
I'm talking about the US, yeah. Amy Glasmeyer at MIT has been working on this concept of what the true living wage is. If you wanted to pay a wage that people could live on, what would it be? She created something called the living wage calculator. You guys can look it up at MIT. It's pretty amazing how far away from the living wage, the minimum wage is in a lot of places. So, you know, I think the one advantage of UBI that we probably won't get a chance to really measure is you could, you know, you can try and take some of the politics out of individual policies with one blanket policy, right? Of course, there'll be politics around the blanket policy, but, you know, there's a bit of research in China, this is not, again, the US, I'm sorry, showing that the more people get resources, the more political support there is. So there's one argument for UBI. If everybody gets a resource, then everybody will support it. So maybe that's, that's one of the reasons the West is also thinking about it. But you should really think about it in substitution of the existing system, not in addition to.
Fantastic. Wow. So I was really looking forward to this conversation, Tavneet. And my only regret is that we didn't have, like, you know, another half an hour, because we could have, I would have learned even more. Like I said, this is just super important, inspiring, and a really great source of pride to have you share this with us. Really, really, really a treat. So I want to thank Tavneet. I want to thank Patsy and Lauren for convening as well. I also want to know, Patsy wanted to encourage me to note that there was discussion about you know, how to support this kind of research. And if you're interested in helping to support the research, you should reach out to Patsy and Lauren in the Office of External Relations team. I want to put a plug in for the next of these sessions. Next one will be August 12th. This will be our final session of the summer, which will be with Professor Retzef Levy. So thanks again to Tavneet, and I want to wish everyone in the wider MIT Sloan community well. Take care, stay safe, and see you soon.
Thank you, Ezra. I really appreciate the kind words.
My pleasure.
Bye, everyone.
Bye, everyone.